kick off. We are going to kick off officially. Welcome to the second session of the Child Abuse Prevention Month webinar series with our theme of shifting from mandated reporting to community supporting. My name is Jessica Matley. I'm a training coordinator and facilitator with the California Training Institute, but some of you might know us best as Caltrin. I hope you do. And I'm going to be your host today. Today, we are excited to bring you a deep dive into the data that exemplifies the need for a shift towards more upstream approaches to support families. This will also include exploring how to use data to create programs and efforts that can contribute to shifting to a community supporting effort. So let's talk through the agenda just a little bit here. Just a couple things to note. We're going to give a brief welcome. You'll have some incredible presenters who I am going to be introducing in a few moments. We actually have some great presenters to dive through content with, and then we're going to close it out. We should be here about 90 minutes or less. We're going to have a good time. If you'd advance me to the next slide, I'll give you just a few more pointers here. Just wanted to give you actually one quick note. Throughout the course of today's session, your presenters might ask you some questions and ask for your thoughts. When they do, you can drop those thoughts into the chat so that everybody can see them. However, if you have a question about the content that you're hearing, you're highly encouraged to use the Q&A feature at the bottom of the screen. So that Q&A feature is specifically for questions that you have. Chat is for comments. So we want to make sure that you have that information as well. One more note that we'd like to make is that this session is being recorded and slides and recording will be shared after the webinar. All right. Now, what I'd like to do, we are actually right on time here. What I'd like to do is introduce our first incredible speaker. Our first presenter today will be Daniel Webster with the California Child Welfare Indicators Project. Daniel Webster is a senior project scientist in the School of Social Welfare at UC Berkeley. Dr. Webster serves as principal investigator of the California Child Welfare Indicators Project, which carries out quarterly production, dissemination, and technical assistance on performance measures to support the state's outcome and accountability system. He has provided consultation to child welfare agencies in multiple states on understanding and applying longitudinal data to promote continuous quality improvement, and has co-instructed courses with colleagues from Chapin Hall to advanced analytics for child welfare administrators. I'd now like to turn it over to Daniel.
Thanks, Jessica. Can you hear me okay? Terrific, great. Thanks for inviting me. Happy to be here. I'm going to kick things off this morning by giving some context and some background on the scope of numbers of children in our state impacted by a child welfare system, especially children of color, notably African American and Native American children who contact our system at much greater degrees, as you'll see in my slides and those by Leanne and Yolanda in a little bit. Actually, as a sidebar, I was looking at the slides last night and I noticed there's a little bit of overlap in some of the slides that I'm presenting and that my colleagues will be presenting later. But one of my favorite sayings is repetition is the key to learning. And so I think it's important to revisit these messages over and over again so that we fully understand them and can communicate to our colleagues and to the community at large. In my slides, I'm going to be underscoring one key issue, the notion of neglect, that very often underlies involvement along the continuum of child welfare services. Direction upstream towards more prevention and community and reinforcement, and hopefully towards a child well-being system through our recently accepted federal FIFSA plan, through the CDSS Center for Excellence, and through a number of county-specific initiatives. We've rightly recognized that neglect needs to be more closely examined, better circumstantially described, and some professionals have even argued that dropped altogether. But again, as we collectively move away from mandated reporting to community supporting mindset, hopefully the impact of that work will make some inroads into decreasing the racial disparities that my colleagues and I will be talking about today. So let's go to the next slide. So neglect, this is the legal definition. I'll read it. You guys can read it. But the point here is that neglect in the law is a pretty broad term. It's very vague, and it can oftentimes obscure other co-occurring factors that are going on. And as we'll see in the data in a moment, it really takes up a lot of the reasons behind the kids at every step that are contacting the system, the reason of record. So it's a broad term, it's a vague term, and we really need to unpack it. Next slide. Some of our colleagues in Lindsay Palmer, Emily Putnam-Hornstein, and some others, in an attempt to try to unpack what are some of the concurrent risk factors that might be underlying neglect, started to look at this. They looked at some case notes through a number of cases, and they found that when neglect was part of the investigation, oh, can I turn my camera off? Yes. Okay, great. So evidently my connection might be a little. Can folks hear me better now? I'm sorry. Is that a little bit better? Can someone give me a heads up on that? I've turned my camera off. Okay.
Yeah, I think
Anyway,
that's better.
I'll just keep talking. Thanks. So thanks, Derek. The point here is that when they looked at these case notes, they did find that there were a number of co-occurring concurrent parental risk factors, such as substance use disorder, mental health, domestic violence, that were in the case notes, but they weren't, part of the reason for the investigation, right? Neglect was. So we really need better data to unpack that. And I will say, at least on a positive note, there has been some recent enhancements to the underlying data collection system, which will do a better job of that, and some work that some colleagues of mine and I did on a substance use disorder data work. We did find that when you pull in some other data sources, we do get a much clearer detail on some of these concurrent risk factors, such as substance use disorder that are going on when neglect is the reason that's been cited. Next slide, please. So all the graphs that I'm going to be showing over the next few minutes are taken from the California Child Welfare Indicators Project website, publicly available data, which is made in partnership with our colleagues at CDSS. If you're not familiar with our website, I would really, encourage you to go there, and my contact information is up there. If you have any questions about what you see there, happy to for you guys to shoot me an email and respond about anything that you see up there. But all the data from the slides I'll be sharing are taken directly from that publicly available data. Next slide, please. So how many kids are we talking about roughly overall that are the subject of an allegation in our state every year? This is year over year frequency counts, the top line, almost 500,000. And when you that 500,000, almost half of them, over 200,000 of them, are for reasons of neglect. The referral reason was neglect. Now, when we look, if some lines, if I were to look at this by the children as the subject of an allegation, if I were to break this apart by do a rate by ethnic group, you would see very large differences between African American, Native American, and other children. And as a matter of fact, in a few moments, I'll be turning to a slide which dwells on that. But this slide is showing us just the number of kids who are coming to our attention that are reasons of neglect. Again, that broad term. Next slide, please. And we go to the next. We go from allegations to substantiation. Well, can we go back up? We missed it. Can we go back up this? Go back up one slide, please. Yeah, children with a substantiated allegation, right? So this is in the neighborhood of about, it's been declining recently, over the past 2 years. It's down to over 50,000 children each year subject of a substantiated allegation, and over 3/4 of them were for reasons of neglect. And again, if I were to break this apart by ethnicity, again, on the slide I'll be showing in a moment, you'll see that the rate by ethnic groups is very different between African Americans, Native Americans, and other children. Next slide, please. This next slide shows us the percent of substantiations out of all allegations, and it's a little bit less than 1 out of 5 allegations end up substantiated. This slide is just showing us that mandated reporters, that the rate that gets substantiated is higher than it is for other reporters. And mandated reporters are going to be law enforcement and child welfare service staff, education, medical staff, that sort of thing. Although even within those groups that I just mentioned, there are very large differences in terms of those allegations submitted by those different mandated reporters and the proportion that end up getting substantiated. It's highest for law enforcement and child welfare services staff, and it's lowest in terms of mandated reported for education staff, which ends up being more close to other types of reporters, which would be, for example, neighbors. Next slide. When we get then into the continuum to the level of children entering care, well, now we're down into the neighborhood of 20-ish thousand per year. And I think you can clearly see that the proportion of those children entering foster care for reasons of neglect is almost 9 out of 10 of them. So the proportion accounted for by neglect keeps going up and up. And so again, this really underscores the need to, as I mentioned, the Palmer work before, we really need to, if 9 out of 10 of our kids entering care are for reasons of neglect, but there are co-occurring risk factors that are involved, we really need to understand what those co-occurring risk factors are, unpack the data so that we can apply services where needed to our clients so they get the services that they need. And then there will probably be, and be able to tease apart those who are not getting the services they need from those for whom maybe they're vague removal reasons that maybe we need to revisit. So let's go to the next slide. So I mentioned how there's large differences for each of those different contact points along the child welfare continuum between different ethnic groups. So this is a calculation of a disparity index, which looks at the disproportionality, the over and under representation of two groups and compares them to each other. So I'll start with the left. The left column on this graph shows us the child population for California for the most recent year. It's about 9 million children. And then hit the down arrow. You can see that I animated this. Maybe I went a little bit crazy on the animation, but you can see that the population, about 5% of the underlying child population are African American children, and that's in the upper right on Black disproportionality. That's my denominator. So of all the kids in the general child population who are Black, 5% of them are Black. But then when I look at entries, hit the next. Okay. 17% of all the entries to foster care, 17.5% of all entries to foster care are Black kids. And so when you compare the 17.5% of Black kids entering care with their presence in the underlying child population, which was 5.7%, hit the next thing. I think you get a factor of 3. So Black kids are overrepresented among children entering foster care. Black children are overrepresented by a factor of 3 times compared to their presence in the underlying child population. So they're overrepresented. They're disproportionately overrepresented. White children, by contrast, hit the next. And white children are 31% of the underlying child population, but then next they are 23% of the children who are entering foster care in a given year. So when I compare the proportion of white kids entering care compared to their presence in the underlying child population, the 23% divided by the 31%, I get a factor of under 1, which is 0.74. Next. So they're 0.74 times as likely to be among children entering care as they are to be in the underlying child population. So white children are disproportionately underrepresented. So Black kids are overrepresented in entries compared to their presence in the child population. White kids are underrepresented. So the disparity is the difference between the two groups, the Black children and the white children. So that would be the 3.3 times factor for Black kids divided by the less than 1 factor for the white kids, 0.74. Next, hit the next button. And then the 3.7 divided by 3.07 divided by 0.74 gives you a factor of about 4, right? So Black children are about 4 times as likely to enter foster care than white kids when compared to their presence in the underlying child population. So that's the disparity index for Black compared to white. It's roughly 4. And this is for entries to care. And if you do this kind of you do this kind of a comparison between groups for different contact points along the child welfare continuum, from allegations to substantiations to entries to care, which we're looking at here, to children in care, you do the same kind of an approach. Next slide. What you get is this racial disparity index, which shows you each Black, Native Americans, Latinos, and Asians all compared to white, which is the vertical axis there in the middle. And so any of those bars going to the left mean that that group is less likely than whites to be present for each of those different child welfare continuum points: allegations, investigations, substantiations, entries, and in care. And then if the bars go to the right, that means they're more likely. So if you look at the blue bar for Black kids, you'll see it's 4.19. So that's the factor of 4 that we just did in the prior slide. So Black kids are about 4 times as likely as white kids to be enter care compared to their presence in the underlying child population. So I think you can see from this graph that for allegations, Black kids are about 3 times as likely. Then it goes up as you move more deeply into the continuum of child welfare services. The Black disparity compared to whites gets larger, and it's similar effect for Native Americans, and Latinos are closer to 1, closer to whites along the continuum, a little bit more here, and then Asian children are less likely than whites at each of these levels of the continuum. This is for the general child population. Next slide, please. We've lost my, okay, well, so but poverty plays an important role. Now, so one of the things that last slide we looked at was comparing the groups with the underlying child population being the general child population, but people have rightly pointed out that poverty plays a large role in the populations of children that we are that are impacted by the child welfare system. And so what this racial disparity index that you're looking at now does is it tries to control for the population of children in poverty, which it varies by racial groups. And so what we've done at Berkeley is I won't bore you with the details, but we take the American Community Survey estimates of populations of children in poverty, and then we use that their estimates of proportions to look at the population estimates of children by the Department of Finance, and we come up with a population of children in poverty. For anyone who's interested in the nuts and bolts of this, there's the link on the slide, and certainly it's on our website. If you want to follow up with me for details, I'm happy to discuss how we did this. But basically, the bottom line is, when we do this first blush attempt to control for poverty, underlying child poverty population, what we see is, yes, the magnitude of the differences change. In some instances for Latinos, they go in the other direction, but for Black children and Native American children, as you get deeper in the system, they are still notably more likely to be the subject of Black kids in investigation, a substantiation, an entry to care, or in care than white kids. And for Native Americans, as you get deep in the system, entries to care and in care, they're still more likely than white kids to be present at those points along the continuum. Next slide. But so this is there's critical renewed emphasis on this absolutely important topic, and the field, I think we've been struggling with this issue for some time, and so the disproportionality and disparity numbers that we've been spending a little time looking at together are a good start. They're definitely a good start. But I wanted to also point out that as some important thinkers, such as Fred Wolshin, have pointed out, that those disparity indices are a great start. They help to point out that there are there's clearly something going on. We clearly have unequitable distribution of services for some of our children, some of our kids, Blacks, Native Americans, are more impacted than other kids. But what we need to do is we need to dig deeper and elucidate the underlying reasons, and those disparity indices don't do that for us. So what we need is deeper, more rigorous analyses that will help us to unpack root causes and barriers to equitable services. And so on this, we put together, here's a few things to think about in terms of where some other data sources that we can start to think about to get at, well, what are driving these disparities from the case level, child characteristics, child histories, to the caseworker indicators, their education, their experience, what are their workloads, what is the agency turnover, things of this nature. From agency, we have agency policies and procedures. What are the visitation policies? What are the fatherhood policies? These kinds of things. And then as we get at structural influences, what are from the other service systems, what is the impact of the courts? We need some court data on how they're influencing some of the decision points and the timelines that we're seeing. What is the service availability? We need to unpack that by what are our providers, what they're making available, referrals that we're identifying the need, as I mentioned, for example, on substance use disorder, mental health, and domestic violence, identifying it, making referrals to services, making sure that our kids are getting the services they need. There are a number of different axes that we need better data to look at to help us to unpack this. Next slide, please. And I've put together these next couple of slides. This one is some important work that's been emerging from some of our colleagues. This one's from the Children's Data Network, the California Strong Start Index, which starts to get at some community factors that would help us to understand what might be underlying these disparities that we're observing. The next slide, please. Let's go to the next slide, which is another similar geographic, kind of a geospatial analysis. This is the community opportunity map that's available through our partners at Casey Family Programs. This is another example of where we can bring to bear some other data sources to help us understand this. So I wanted to be real and point out that there are complexities to what is very definitely a social justice issue. But I've no doubt that we can do this together, and we certainly have the brain power and the experience and the will to carry this out together. And I think my colleagues Leanne and Yolanda have some good ideas to help us embark on this important work. So I'll end there and turn it back over to the moderator.
Thank you so much. I want to just ask a couple questions that we have in the Q&A feature, if you don't mind, Daniel. One question
Absolutely.
that we have here is, what definition is being used for domestic violence or mental illness? Is it based on the law or science, social science, or both? Is a medical diagnosis required?
that's a really good question. When I say those things, when I mentioned the Palmer study, I would have to go back and look. I don't know what the case notes said. I wasn't part of the study, but that's an excellent question. I would have to go back and review the methodology on that particular study. That's a great question, and that's the kind of thing that we need. That we need that kind of clarity and that kind of standardization as we start to unpack those issues. I will say, when I mentioned the work of the substance use disorder work group, that I talked about how we looked at the prevalence of substance use disorder among different levels of system contact. We saw that was much higher than what you see in the structured data. But there again, from our SACWA system, for that one, we pulled in data from the structured decision-making risk tool, and so for that, I would turn to our experts that utilize that tool, and I would ask them, to what degree are they applying these legal definitions that the questioner is asking when they make that determination and put it in the risk assessment tool. So I hope I'm not being too equivocal. I'm not trying to pass the buck, but I think it's an excellent question. We do need to be very clear about those definitions, and to the extent that we can all be talking the same language, I think that's important as we can try to draw these numbers into focus. But thanks for that. Reach out if you want to talk more about it. But I certainly think the details are going to be in the methodology for the academic papers, and certainly for the use by the risk assessment tools by our colleagues in the field.
Great. Just a few more questions. Is there disaggregate data of ethnicities and not just racial groups?
Yes, we by ethnicity, race and ethnicity, the way our data are coded in our SACWA system, we've got currently primary ethnicity, and then we've got Hispanic origin, which is used to group many different categories into the handful of categories that we report. And so yes, we've got those different dimensions in the data system. And I will say, in the new data system that is being developed, the new CARE system, there's a lot of work being done to collect even more granularity of people's ethnic and racial backgrounds, so that the hope there is to be able to come up with some much more nuanced taxonomies of different folks, different racial and ethnic origins. But that work has yet to be done. I mean, the data system is just being put in place to collect that at a more granular level. Currently, we are a little bit limited in the data we collect, and then those categories that I shared with you on the screen are even reductive from that. But certainly open to conversations if people want to revisit how those, anytime you summarize information, you lose detail, important detail. And certainly we at Berkeley, and I'm sure our colleagues at CDSS, are open to conversations about how we may need to reconceptualize some of these racial and ethnic categories to be more representative of the populations we're working with. And so I certainly welcome those conversations if folks want to reach out and have them.
Thank you. Looks like we have time for just about 2 more questions. The next question is, for reference, when looking at the disproportionality rate, would a calculation of 1 be considered an accurate representation versus the 3.07 overrepresentation and 0.74 underrepresentation for Black and white, respectively?
That's a mouthful. Could you maybe repeat that question?
Sure. I might even copy and drop it right into the chat.
Okay. Yeah.
If I can. Let's see here.
I mean, by accurate, well, I mean, it's as accurate as I'm looking at, would a calculation of 1 be considered accurate? Well, I mean, the data are as accurate as they can be, right? I mean, we're pulling this from the data system. That comparison is looking at, in the example I gave, we looked at the presence in the decision point entries versus in that denominator. What was the proportion of that denominator was Black compared to the proportion of all children in the general child population that were Black. You can make that same disparity index by looking at a rate of children, which is basically takes the numbers of kids in the entries for Blacks divided by the number of kids in the general child population. You come up with a rate of entries to care and compare the two rates together. Is it accurate? It's as accurate as the data, are in our system with full recognition of the prior person's questions about how are we coding these children in terms of their ethnic group, for one, and then also how accurate are our underlying child population estimates that we're using for our denominators. So yeah, I mean, they're as accurate as these kinds of data can be. I think that those disparity indices that I showed you they're robust. We've observed those differences I didn't have a longitudinal view of it, but if you look over time, you can certainly see those disparities. We've observed them over time. So using the constructs as we put them together, they're as accurate as they can be. I mean, if people have questions about how we're coding the data, then we can always revisit that and recode it and see, what our results look like. I think they're very accurate, and they're as accurate as our data permits them to be. I hope that answers the question.
Sure. And this is the last question. We have about 3 minutes to respond. Do we know anything about disparities involving parents who are disabled? This comes from a participant who works in an agency that supports people with disabilities.
Boy, I really appreciate that question. That is a great question. I should have put that in my slides, and I will for the next time. That's another dimension of our data that we don't. I think there are places in the underlying data to capture that information, but to my shame, we at Berkeley haven't delved in and looked at that data yet, and we need to look at that. There are certain populations that these disparities that I talked about, we're focusing a lot today on racial disparities, but there are disparities for groups that disabled folks that we need to do a better job of helping. There are also SOGI, dimensions of SOGI, sexual orientation and gender identity expression dimensions of our data that we need to do a better job of making sure that we give equitable services to those populations as well. Our data, I don't think, are there yet. We've got, for example, on SOGI, we're entering that data now. We've got some data collection. Disability, I think it's in there, but I don't know how well it's being entered. But I've made a note here to myself to maybe take it back and with my colleagues and start to look at that. And hopefully at a future presentation, I'll have something intelligent to say about that. But I do appreciate the question. We do need to examine our work for those populations as well. So thank you for raising that up.
Great. Well, we just want to say on behalf of participants and the other panelists, thank you, Daniel, for your presentation of the data and current status of child welfare involvement in California. Your insight, your perspective really brings an important perspective of data analysis that is vital to including into program efforts for supporting families. So thank you so much. And now, if you will advance me to the next slide, I believe we're going to shift to a discussion by Chapin Hall to further explore the data, measurement, and engagement strategies for community support. We are joined today by both Dr. Leanne Heaton and Yolanda Green-Rogers. Dr. Leanne Heaton is a senior researcher and data manager at Chapin Hall at the University of Chicago. She serves as the principal investigator and/or research and evaluation lead on several state-funded human services public policy initiatives and supervises a team of researchers and analysts. In this capacity, she advises human service administrators on their use of research, evaluation, and data to inform development. To inform data, development, implementation, and monitoring of public policies to improve outcomes for vulnerable children, youth, and families. Dr. Heaton provides guidance to state child welfare agencies implementing the continuous quality improvement provisions of the Family First Prevention Services Act and serves as a Child and Family Services Review subject matter expert. Our second presenter, Yolanda Green Rogers, is a senior policy analyst at Chapin Hall at the University of Chicago. She works with public and private social service agencies across the country on the implementation of continuous quality improvement practices and protocols that support performance monitoring, improvement planning, and decision-making. Yolanda conducts assessments of CQI processes, makes recommendations to leaders on using CQI process to achieve priority outcomes, and delivers training and coaching to increase staff capacity in implementing CQI principles. Yolanda is also an adjunct lecturer on quality improvement in the social services at the University of Chicago's Crown School of Social Work, Policy, and Practice. With that, Leanne and Yolanda, please take it away.
All right, thank you so much, Jessica. Leanne and I are super happy to be here and to be a part of this really important discussion that's not only taking place here in California, but across the country as many jurisdictions work to transform their existing child welfare systems into the child and family and community well-being systems that focus on partnering with providers, communities, and lived experts to keep families together. And we also like to thank Daniel for a wonderful setup to continue this discussion about using data measurement and engagement strategies for community collaboration and support. Next slide. So Leanne and I'll be sharing some best practices for collecting data and using it to measure disproportionality and discussing how that information can inform programming. And Leanne will be using an applied example to do that. And I'll be bookending that discussion with approaches and strategies around engaging local communities and stakeholders in this effort around systems transformation and using data and evidence in that regard. Next slide. And you could go ahead and put all those up. Thanks, Crystal. So before diving back into the data, we think it's important to take a step back, take a breath, and think about how to approach equity engagement in our efforts to, again, promote this community support and systems transformation work we're engaged in. We think it's important to approach this work informed and operating from a set of guiding principles. The principles that you see here on the screen that are outlined here were developed as part of a collaborative partnership between representatives from Casey Family Programs, Chapin Hall, the Capacity Building Center for States, ICF, James Bell and Associates, and the University of South Florida. This partnership resulted in 2 recently released resources, one on racial equity and engagement in research and evaluation, and the other on racial equity and engagement in continuous quality improvement, or CQI processes. Both resources outline a set of strategies on what applying a racial equity lens and being intentional about engagement, what that looks like as part of a CQI or evaluation process. But again, before outlining strategies, we thought through a set of guiding principles from which to operate to engage in this work. And I'm just going to touch on a few of these principles. So principle 1, identifying specific strategies and oversight. So as we think about this shift from mandated reporting to community supporting, as you pursue community pathways that keep children and families together, we need to think through what it will take to authentically engage communities and other partners in this work and maintain equity as a priority. This will require careful thought, planning, and oversight. Principle 2, approach this work with humility. Super important, and be open to new ways of doing things. We need to get ready to share power, be ready to listen and learn more than we speak and direct. Principle 3, including community representation and engaged lived experts. And this is about being intentional and courageous about engaging and collaborating with your provider community and other key community partners. What are the problems you're trying to solve? Who's affected by those problems? And how can you best partner with them? And then finally, we'll look at principle 6, examining our own biases. As leaders, project team members, decision makers, we must be intentionally and continually examining our own internal biases, realizing we have them, every human comes with some, and be aware of how those impact our behaviors and relationships and decisions in this work. So we think of this work as engaging critical perspectives. The folks and the partners you need to engage have more than an interest, they have solutions. And the next few slides will help us think through how to lay the groundwork for partnering with those critical perspectives. Next slide. So this is around doing our homework, understanding and being honest about the role of child welfare, the role the Child Welfare Agency has played in the communities we're serving, and how the agency is perceived by the community, whatever that perception is, being aware. And then finding out the community's perspective on the issues you want to engage them around, and being aware of the language that we use to talk about those issues. Next slide. Here we want to make sure there's an infrastructure in place to give this work the attention that it deserves. Building trust and relationships and nurturing those relationships is a journey and a process that takes time and commitment. Setting realistic expectations about the time and resources that you're going to need to be able to identify key partners, conduct the outreach, and build those long-term relationships. Planning for how critical partners who you want engaged for the long haul will be compensated for their time and effort at the table with other partners who have built-in compensation. And then making sure those who are responsible for leading the work actually have the time and the space carved out in their day-to-day work to be present and to lead effectively. Next slide. And finally, being intentional about establishing clear communication pathways and feedback loops in the work. In what forms will performance data and evidence be discussed? Where will you talk about root causes or identify root causes and develop improvement strategies and partnership with your communities? And this is a strong nod to the role of CQI in this work, and we'll talk a little bit about that later. How often will gatherings take place? Who are the key participants in those various forms you're going to need to facilitate? Next slide. So hopefully some of what you've heard so far is helping you think through exactly where you are or need to be in your efforts to intentionally and authentically partner with service providers. As part of looking at the rigorous data that we generate, how do we get these voices included, even your workforce, in our efforts to create this child and family and community well-being system we're striving for. So we'd like to take a minute to hear your thoughts about what challenges you might be facing in your engagement efforts, or what challenges you anticipate as you make plans to engage in this transformational work. So you can respond to this question in the chat, and then Jessica will read a few of those responses as they come in. We'll spend just a minute here and just see what your thoughts are.
It looks like there may be one question here that I see.
Okay.
What methods for not only discovery and awareness of internal bias do you recommend, but are there also trainings offered to correct the biased responses people can unconsciously operate from?
Yeah, so I can't point to specific resources in this moment, but there are resources around implicit bias. There are resources out there. So that might be something I can pull together and maybe send to Caltran
Sure.
and the department to share. But yes, there are structured guides and resources out there to help folks work through that implicit bias issue.
Got it. And it looks in the chat like we have some responses to your first question. What is the biggest challenge with engaging community? I see limited funding for bilingual staff, staffing challenges, lack of trust. Agency does not compensate folks with lived expertise at this time. Funding for new ideas and staffing, again, with lack of trust funding, community partner reluctance, engaging direct service staff when vacancies and workloads are high. Let's see, building trust between family agencies and reporting parties, reluctance,
Mhm. Yeah.
folks still recovering from those challenges of COVID-19 pandemic.
Mhm.
Mhm.
So all those are super important and spot on in terms of the challenges that we face in this work, and why it's really important to really think through the strategies. How are you going to address some of those issues before you try to engage in the initiative around engaging folks and having folks come to different tables for these conversations? Leadership is important. Overall transformational efforts that are being articulated by the state are super important, and how the state's going to operationalize those big strategic plans, because all of what you talked about is kind of built into our strategic planning work, but how are we going to operationalize that? Leadership plays a key role in that, and having those conversations to get ready to do the work. All of those are spot on and critical in getting ready to do the work, and need to be really strategized about and talked about while you're trying to engage or before trying to engage. So I'm going to go ahead and move us along. Thank you for that. I am going to now turn it over. If you go to the next slide, I'm going to go ahead and turn it over to my colleague Leanne to talk to us about using data and evidence to advance race equity and inform our prevention planning. Over to you, Leanne.
Okay, great, Yolanda. Thanks so much for that introduction. And thank you, Daniel, for the introductory presentation. What I'd like to do next is just spend maybe about 15, 18 minutes or so, and we're going to dive into an applied example. So I'm going to talk a little bit about data, but more to get us thinking, and also just kind of helping us think through how you can use data to really understand maybe what's going on in your community, but use it in a way that invites folks into a conversation. So I'm going to build on some of what Daniel said in a little bit more detail, but hopefully what we're going to do together over the next few minutes is really about unpacking a story of what might be going on with some youth in California right now. And I want to ask you really to think about it critically as we go through this, and then apply some of those principles, think through some of the other information that Yolanda is going to share, so we can kind of figure out what might be some strategies or a solution to what we're going to talk about in a few minutes. So next slide. I'm going to start with just some data points. It's going to highlight some of what Daniel said earlier, but folks on the call may or may not know, but on a national level, 85% of families that are investigated by Child Protective Services actually earn 200% below the federal poverty line. So when you think about that, there's a direct connection between poverty and system involvement. Next slide. The next data point I want to show you is about 70% or almost 70% of families with income below that poverty line that I just talked about, they experience material hardships. And when we say material hardships, it's just things like we all need, right? Like housing, utilities, food, medical care. And what can be compounded as a subset, a large percent actually, can also experience like a hard financial shock. So like perhaps you might go lose your job for a period of weeks, or have some major expense that you weren't prepared for. All of these kinds of things elevate the risk for system involvement. These are things that we can actually do something about in community prevention. We don't have to reach out to a Child Protective Services response. That's what I'm going to ask you to think about, the opportunities here to do something different to support folks. Next slide. So want to just make the connection also here with the overrepresentation of children and families of color. And what this slide is going to show you, and probably a lot of folks on this call already know this, but I just want to call it to our attention again, that there are systemic inequities. There were deliberate things in our history that prevented families of color, families from tribes, from obtaining the kinds of resources that some other folks have had access to. That places certain subpopulations greater risk of economic hardship. And when you think about that relationship with poverty, that is why we see a lot of the overrepresentation of children and families of color in our systems, and why we are inviting you to really think about supporting and resourcing community in a different way. These are things that we can do something about that don't require government intervention at its most intrusive form. Now, sometimes it's necessary, but there's a lot more children and families that we could help upstream. And that's what we want to talk through today. Next slide. Okay, so we're going to go back to data just for a little bit, and I'm just going to highlight, I'm not going to spend a lot of time on some of these slides because Daniel did a great job of already walking through a few of these same metrics. But we wanted to add them in here. Once again, Yolanda and I share this information all over the country, and we just want to elevate them again because these are very simple things that you can do to really understand your data, to understand first, do you have a problem with disproportionality and disparity? And if you do, it sets up a way that you can track it to see if you're making progress. Next slide. Okay, so Daniel talked a lot about these already, and I just want to highlight a couple more examples. When I talk about, like, when I work with states and we talk about, okay, how do we know if we have a problem, and then how do we set up the infrastructure to track it? There's really just three simple things that I like to say. Just think about tracking the 3 Ds. Disaggregate your data, look for evidence of disproportionality and disparity. And simple things that you can do, and it doesn't require much background at all, just simply a love of just a few simple numbers. So next slide. So this is very similar to what Daniel just showed you. Child population, foster care population. This is just a simple visual of disaggregated data by race and ethnicity. One thing I want to highlight on this slide that we haven't talked about yet is looking at the very small bars, and you probably can't see it very well in this slide. And I recognize that when I put these together, but I wanted to draw your attention to the 0% at the very top in the child youth population, and then the 0.6 that's at the very top of the foster care population. So why am I talking about that? Because that is missing data. And that is an important equity point. If you want to understand if you have a problem with disproportionality and disparities, if you want to understand if you're making progress, missing data can be a barrier to that process. So I just want to highlight that one thing. The second thing I want to show you, and this is data that's pulled directly from Kids Count, which this is California data that your state social services collects. It's sent to the federal government. Data Center Kids Counts pulls it down. So it's going to be almost identical to what Daniel showed you, depending on which year. But another thing is just how race and ethnicity is grouped. One thing that we always like to do is, even though the numbers are really small in this visual, we always like to show all groups. And again, even subpopulations in California, which may have very small numbers, as you can see here at the bottom, we still want to understand these populations because these are still children and families that you serve. And so we want to include everybody when we disaggregate information by race and ethnicity. Next slide. This is just an example again of what Daniel showed you on how you can calculate disproportionality. Anything over 1 is overrepresentation, anything under is underrepresentation. So we won't go through this again. Next slide. The next slide is very similar to what Daniel showed you on disparities. So I'm going to go ahead and go to the next slide. You can actually go and find this right now on the website, the California Child Welfare Indicators Project that Daniel mentioned. And I like to show this because if you look at the left-hand side, you can look at different points of contact that children and families have in California. You can select a time period, but you can also select a specific county. And this table right here shows you a disparity index. Key thing about disparities are, to really understand them, you have to have a comparison group. The example that Daniel showed you earlier was a comparison with white children. But here, this table allows you to compare every race and ethnic group that is shown with every other one. So if you're very interested in comparing, say, Latino, Latina children, and you want to compare those to the Black children that are in your county, you can do that with this table. Just one other point here, a number of 1.0 just means complete agreement with itself. So like, for example, you can see white, 1 is compared with white, it's going to be 1. That's just a simple way to say, hey, I'm comparing this group with this same group, and so it's 100% agreement. That's what the 1 means. Now, the next slide will show you that same data table and actually a chart that you can do for yourself. If we want to go to the next slide, thank you. So here, I've got it subset to foster care entries, and I've got what is the comparison group. But again, you can change this. You can also put your county in. You can look at allegations in your county, and you can see that it gives you a nice way to understand the measure. So all of this data is publicly available and at your disposal. So if you don't want to do any calculations yourself, but really want to understand the county in which you live, this dashboard allows you to do it. Next slide. Okay, so we're going to pause here just for a quick poll, and then I'm going to walk us through an applied example. So we want to spend maybe about 10, 15 seconds. I'm going to ask the moderator, Jessica or Crystal, to put the poll up. And what we want to know from all of you is, right now, are you looking at your data by race and ethnicity? Just simply looking at the disaggregated data to know who you're serving or who you can serve better. Wonderful to see this. So a large portion, it looks like, we have about half or so answered at this point. We've got a pretty big majority here that you do look at your data by race and ethnicity. That's wonderful. And even if you don't, there's always opportunities to start doing so. And we're going to show you why it might be a good idea to do in just a minute. Okay, thank you very much. Excited to see these numbers. Okay. We'll go on to the next slide. Thank you for participating in that exercise. It's important for us to see how many folks are already thinking about this and why it's so important. Okay, so an applied example. So when you are looking at your data and you're creating your community partnership groups where you have child welfare and you have other important community service providers, your prevention advocates, lived experience, all the folks at the table that you want to really hone in on supporting and prevention, I like to start with the data point. Data can be such a powerful way to get folks talking and really engaged in, well, what's going on? So I kind of think about this as the who, why, and where. Next slide. So today we can define the problem in 2 ways, because this is a presentation about moving to mandatory or mandated supporting. And we want to try to reduce as much system involvement with child protective services and child welfare as we can, particularly things that can be addressed and should be addressed in the community. So if we think about that as the ultimate goal, there are 2 things that we always want to be aware of. 1, the very front door, the number of child protective services referrals. Some states call them reports. Sometimes states can call them various allegations or so forth. But the federal government tends to call them referrals. So the idea is there is some concern about possible maltreatment. So we're going to call child protective services. Well, we argue, and we can see in data earlier, that probably a lot of these referrals, not necessarily abuse and neglect, Or if we have better community supports, we could reduce the stress, we could reduce financial burden, and really lower the risk of involvement, right? So that's one measure that I would invite all of you to start thinking about in your locality or your community or your county. The second measure that we want to keep an eye on is foster care entrance. That's something that we really want to reduce also, unless it's absolutely necessary for a temporary stay until other permanent safe arrangements can be made. So those are the two things we're going to be thinking about setting up an infrastructure to track. And we want it, these are what we would say, we want to reduce these. So in order to do that, we always want to track who is being referred and who is being entering care. And a lot of times we like to disaggregate by race and ethnicity, but we also like to disaggregate by age. The reason why that becomes important is because, as you all know, services are tailored a lot of times by the child's developmental age. So we think about home visiting programs, and those for younger infants, for younger children, 0 to 3, 0 to 5. We also know that there's a lot of good services out there and needed services for teenagers. So 12 and older, for example. So we tend to want to look at those kinds of things and disaggregate by race and ethnicity when you're getting referrals and when you're looking at foster care entrance. We also want to look at why. Is it neglect? Is it due to child behavior problems? I'm going to show you a couple of slides in a moment that illustrate an applied example. And all of you ought to be really curious about why this might be occurring in California. Next slide. And then the last part is where. So I'm showing you back again something that a resource Daniel already showed you. It's called the California Strong Start Index. The purpose of this resource is to really help communities, planners, those that are really invested in changing the course, the trajectory of infants, and making sure the community is well resourced and strong. This is what this particular resource provides you the opportunity to do, to see how much resilience or index of resilience is in a particular zip code. You can filter by county. This right here, I have filtered this screenshot to an index of fewer than 8. So what we want is we want all communities to be at 11 and 12. That's the ideal. So in places where we have fewer than 8, those are opportunities to think about how we can resource prevention to prevent the two outcomes that we just talked about, referrals to CPS and foster care entrance. Okay, next slide. All right, so this is just another screenshot of what you can do with this data. The authors, the folks that put together this website, explicitly state that folks can use this data to prioritize communities for investment. It also has the ability to disaggregate some of these indices by race and ethnicity so that you can see disparities. So again, here on the right, you can see the disaggregated information. And what we want is, we want those bars to be really bigger, wider, more percentages across all race and ethnicities at 11 or 12. And you can see right now that some subpopulations have more 11 and 12s and others don't. We want to change that. We want to change that. Next slide. Okay, so I've shown you all the resources, and now I'm just going to spend about 5 minutes hoping to get you curious with this example. Next slide. Okay, so we said who, and then we want to dig into why. So one of the things we've been looking a lot at Chapin Hall is prevention. We talk about it quite a bit, and we work in a lot of jurisdictions supporting family first, as you heard. And one of our main goals is to really help states resource prevention. So one of the places we start with data work is to look at, okay, fundamental to family first is preventing foster care entries, if we can. So let's look at who is coming into foster care. So we notice this interesting pattern, and this is California percentage, but this is fairly consistent nationally. Every year, and it's fairly consistent over the last 6 years, little under a quarter of all foster care entries are teenagers. So you have to think about that for a minute. That's youth ages 12 to 17. So it got us really curious, like, okay, wait a minute, what is driving teenagers into foster care? I mean, those of us that have worked in systems as frontline caseworkers in mental health, juvenile justice, child welfare, in the community, we all know that teenagers are a really tough population to find family-based homes for. So we started thinking, okay, wait a minute, we need to figure out what's going on so maybe we can figure out ways to resource community differently. So that's what we did. We kind of looked at next, why? Next slide, please. So we decided we would look at national data. And then we also, for this presentation, put together some California data, which we're about to show you, that kind of answers this first question. Not totally, but it gets us started on the answer to this. And then we disaggregate by race and ethnicity. And that's what I'm going to show you next. Next slide. Okay, so why are youth ages 12 to 17 entering foster care? What are the circumstances of that initial removal? And this is California data that your state submits to the federal government. It's called AFCARS. And then for researchers or other folks that are interested in it, we can go and request permission to have it, and we can look across states. And this happens to be California. And what I'm showing you is 2020 data point. But it's not much different if you look across all 6 years of data, which we did. And the top reason is neglect. The second, caregiver inability to cope. And the third, physical abuse. But the fourth, child behavior problem. Okay, let's just spend a couple of seconds thinking about neglect. You've got almost 70% of teenagers entering foster care in this construct we call neglect. Now, it's really hard to know in national data what this means. When we have disaggregated this in other states, sometimes this means like a supervision. This can mean all kinds of other things. But when you think about developmentally for a teenager, neglect for a teenager is quite different than neglect for, say, a 1-year-old. So that is something just to keep in mind and think about. So we can't know a lot about that in national data, but you can dig into it a lot more at a local level. So that's something I'm planting in your mind and as something to be curious about. Next slide. The next thing that I want to just point out here, if we think about the classic constructs of abuse and neglect, a caregiver not being able to cope with a child, a teenager, or a child behavior problem, I would argue, in addition to the neglect construct, but particularly the ones that are circled, these are indication of service needs. One would argue this is not child abuse and neglect. Service needs that we can really have an opportunity to do something better with. Next slide. So now let's look at it disaggregated real quick, and then we'll close out here in just a couple of minutes. Again, this is California data, and what we've done is just visualize it disaggregated. So the orange shows the percentage within each racial and ethnic group that this initial removal reason was present for this age population, teenagers, 12 to 17. And what we're doing here is just simple. These are the top 4 largest racial and ethnic groups in California. So we have them grouped together because of the scaling. And we're not doing anything fancy here. We're not testing differences. We're not doing a research project. All we're doing is looking at patterns. And we see that the patterns are fairly similar here. About a third of the time when we disaggregate across these 3 or 4 racial and ethnic groups, we see that this initial reason for removal, not being able to cope, again, this is something we could do something about. Next slide. This is your smaller racial and ethnic groups, your smaller populations. And again, what I mentioned, if we're thinking about equity, we never want to not show groups, and we want to try to disaggregate as much as the data will allow us. This is as much as the data would allow us. The circled part that I wanted to show you is this is the unknown race and ethnicity. and it's over a third. So we've got youth being removed for this reason, and their race and ethnicity is not documented. This is a problem because they may have unique needs based on where they live, their community, by specific things that may have happened to them historically, race and ethnicity groups, but we don't know. So it's just something that we want to figure out, how can we do better in terms of documentation. The next thing I want to show you is we do have some small group subpopulations shown on here. The Hawaiian other Pacific Islander grouping that this data groups together. And even though those numbers are small, we don't want to group them. We don't want to collapse them. When we're talking about applied work and looking at data and coming up with service solutions, we want to know that, because we may need specialized services. We may need to have a different community that's involved in the solutions. So this is why we keep everything disaggregated as much as possible when we're talking about applied work. And what we see here is very similar patterns, except with American Indian and Alaska Native youth, where this tends to be less common as a reason for initial removal. Okay, next slide. Just a couple of more minutes and we're going to turn it back over to Yolanda. This shows behavior problems. Again, these are your top 4 race and ethnic groups in California. And we start to see a little bit of a different pattern here where this is documented by race and ethnicity. And I just want to say here, as we look at these numbers, almost 15%, this is documented for Black youth, 11% for more than one race, 9.7 for white youth, 8.2 for Hispanic youth. This doesn't necessarily mean, when we think about historically, in some of the conversation we had earlier about biases being implicit, this doesn't necessarily mean that behavior problems are more common. What it is likely to mean is it may be documented more common for certain groups. But it's something for your community partnership prevention groups to kind of really think about and talk about together what this might mean. Okay, next slide. And again, because we haven't collapsed groups, even though we have small numbers and we know the percentages can be inflated when we have small numbers, we do see different patterns here. And again, this may be an indication that we have unique needs and we need particular parts of the community to come together that represent the youth that are being removed for behavior problems. So that's what the slide shows here. Okay, now let's summarize, next slide, what we just talked about. Okay, so we have teenagers. A good proportion of them are coming in for behavior problems, caregiver inability to cope. We know that there are some different patterns by race and ethnicity. So what are the equity implications? Number one, we believe that prevention services, cross-system, coordinated, can reduce youth from entering care. If we do that, we reduce all youth from entering foster care. We will reduce disproportionality and disparity naturally, because children and youth of color are overrepresented in foster care. We also know that some populations are more likely to be labeled as having certain problems or issues. That may or may not be true, but regardless, these things can be a driver of system involvement. So we always want to be aware. And because of that, we have to work with community and develop prevention strategies for subpopulations that are driven by their communities. Because as Yolanda mentioned earlier, communities likely know the answer. So we work with them, we'll get to that solution much quicker. Okay, gonna wrap up with a couple more resources and then turn it over to Yolanda. Next slide. Okay, a challenge for all of you today, go back and look at this in your local county, in your neighborhood. Are you seeing teenagers entering foster care? And if you are, look at why and look at where it's happening and see if we can't do something about it from a prevention lens. Next slide. Some financial resources to help are Family First, EBPs, they're shown there. And when you braid that with Medicaid, and lots of states are doing those two things together, you end up being able to create a lot more resources to support youth with complex behavioral health needs so that they can stay in their communities and with their families. Next slide. This is a resource for all of you. If you didn't know, California updated its Medicaid criteria. You can see that you don't necessarily have to have a mental health diagnosis anymore. There are all these other criteria that make you eligible for that particular service. And I'll put the link there. You can look more about it. And then the last slide before I turn it over to Yolanda, next slide, is this community pathways. This was submitted in the California Prevention Plan. And all of these different entry points are mentioned in the plan, and that becomes important to be able to draw down the kind of money that you need fiscally to start solving some of these at the front end. Okay, Yolanda, I'm going to turn it back over to you. And thank you all very much for letting me share this information.
Okay, thanks, Leanne. Next slide. So now, as I mentioned early on, I'm just basically bookending the data conversations that we're having and bookending that with authentic engagement, using that rigorous analysis, data analysis, marrying that rigorous data analysis and evidence with authentic engagement of providers, community representatives, and lived experts, as well as your workforce. Next slide. So once you delved into the data, again, hopefully in partnership with those with critical perspectives, how do you think about moving forward? So let's ground ourselves again in engagement to inform our thinking about the data and turn it into the evidence we need to address some of the issues that we're talking about. These overarching strategies operationalize some of the guiding principles we talked about at the top. And we're framing these strategies in a CQI context, because within the CQI process, or the continuous quality improvement process, that can be where the magic happens, where intentional attention and ongoing consistent action can happen, where these issues are kept in the forefront on a routine and regular basis. That's inherent in a continuous quality improvement process supported by rigorous data analysis. This is a complex journey that will, again, require consistent attention and action through tracking, monitoring, and recalibrating our efforts. So regardless of where you are in the CQI process itself, there are certain important strategies that you can consider, that can be considered and applied at every step to try to get at racial equity and engagement. And these strategies should be promoted and supported by organizational leaders. So let's just take a quick look at a few of those. Next slide. So this notion of grounding, and again, these operationalize some of the principles that we talked about at the top. Self-reflection, super important, the question around implicit bias and some of those tools, that examining of our own background and biases and how they influence our attitude is really critical to do. Making sure we're investing assets in relationship building, and invested in co-designing and testing instruments and planning, and inviting folks into the CQI process to develop tools and monitoring to inform those processes. And then collective understanding. CQI leaders and process participants need shared understanding of race, equity, and inclusion principles. Is there a DEIB or a diversity, equity, inclusion framework? Is racial equity, social justice, are those things ingrained in your strategic planning and operationalized in any routine way that everyone across your organization understands? Someone made a point, I'll digress just for a second, because someone made I think a comment or a point in the chat about training and the mandated reporter versus community supporter trainings, and that it can't just be training. And you're exactly right. The research shows that the training partnered with coaching and partnering that with continuous quality improvement efforts can help some of those efforts be stronger. So you're exactly right around understanding principles coming from a space of having a set of principles in front of you and having those articulated across your organization. Next slide. We also want to talk about centering communities of color, centering the interests, values, and desired outcomes of Black, Brown, and Native communities in the CQI work at those tables where we're continuously looking at rigorous data and the disaggregated data and making meaning, helping to make meaning of that data. Establishing lived expertise in these conversations, which could include things like establishing advisory boards with youth and family voice. If you have an existing board, integrating youth and family voice into those existing systems. Next slide. And then finally, cross-systems partnerships, which is a critical part, I think, of all of what we're talking about as California moves toward the mandated reporter versus community supporter piece, the child and family and community well-being work, the community pathways work. It is incumbent upon us to have cross-systems partnerships. There's no other way to do that work, and building and expanding partnerships across organizations for collective impact. And then the funding issue, working through the funding issue, sustained funding for continued and expanded participation of diverse communities in the work. So in order to sustain these efforts. Next slide. And then I'll just leave us with, again, I'm a CQI advocate. That's the space that I live in for pretty much everything. So I just wanted to kind of go around. I'm pretty sure a lot of the counties in California use the Plan, Do, Study, Act cycle. It's not the only improvement planning methodology where you're doing small tests of change, but I think it's one that several of the communities in California use. So embedding these engagement strategies actually in your CQI processes in this Plan, Do, Study, Act scenario. And Crystal, you can kind of just go ahead and animate these and tap all the way around. So engaging the right team in the planning stage, which again is the longest stage, the most arduous stage of the improvement planning cycle, because that's where you're looking at the data, gathering the data, being informed by the rigorous data and analysis, and getting the right people to the table, exploring root causes with your key stakeholders and lived experts, trying to identify potential strategies and solutions, and identifying your roadmap and benchmarks and targets. And then implementing those solutions. And we know implementation is really a thing, that there's monitoring efforts that need to happen in your implementation work when you're implementing a new strategy, trying to always coming back to the table to figure out if you're implementing that strategy with fidelity. Are you doing it the way you said you wanted to do it? And having, again, those key voices at the table to help you understand that. And I always add, including the workforce, because they'll be able to tell you really how things are going on the ground with some of the wonderful things we want to implement. And then the study phase of it, coming back to that table, the ongoing review of rigorous data and turning it into evidence, and talking to our stakeholders and communities and decision makers about the progress and the impact, not just in the planning phase to get folks' opinions, but as you continually look at the data and review the data, get engaging those voices in that process. And then finally, the ACT piece of the Plan, Do, Study, Act, where a lot of times we never get, we're just implementing and looking at data, and then we implement and look at data, but actually using the data and the evidence to make decisions, determining the extent to which the problem still exists, having, again, those right folks at the table on this ongoing basis to help make decisions and really take a look at what needs to happen next. So again, just a way to center some of the activities and things and principles that we're talking about actually in your continuous quality improvement process. Next slide. And then just real quickly, just some of the benefits of doing that. And I would think that some of these are kind of obvious, and we've talked about these: promoting authentic engagement, improved accuracy and dissemination, because it's not just one set of folks looking at the data. You have a diverse body of folks at the table with varying experiences to be able to help determine if the data that you're disseminating is accurate. The potential for influence on policies and practices, and making adjustments in those practices to enhance them. And then really improves the likelihood that CQI efforts will benefit the most affected communities. Next slide. And I think we have one more quick poll. How ready is your organization to apply principles, to apply the principles and strategies you've heard talked about today? How confident do you feel on the road that you're on or the road that you're about to embark on? We got a few, so very ready. Looks like the somewhat ready. Most of you are somewhat ready, which is good. On the road. We'll wait a couple more seconds. But it looks like what we're seeing here, if you want to go ahead and end the poll, that most people feel somewhat ready. And that's good. And we got a third of folks that feel very ready, which is awesome. So conversations around what that readiness is about would be interesting as well. But thank you for that. Next slide. So that concludes our presentation for today. There's a list of resources here in the slide deck that you'll receive that you can reflect on. And the final slide, we just want to thank you for inviting us to participate in this conversation. And feel free to reach out if you have questions as you move forward. Jessica, I'll turn it back to you.
Great. Thank you so much to Leanne and Yolanda and to all of our presenters today. We appreciate your expertise in elevating the importance of moving further upstream to shift from solely mandated reporting to community supporting with the goal of keeping children, families, and communities happy, healthy, and thriving. Thank you all to you participants. We're very excited to have you all join us today for the remaining CAP month webinars. So speaking of, our next webinar will be held next Wednesday, that's April 19th, from 11 a.m. to 12:30 p.m. And you can register by accessing the link in the chat. There'll be a link in there for you. The next webinar is titled Community Supporting the Paradigm Shift for County Child Welfare, and will be an opportunity to explore the impacts of a community supporting shift at the local level through 3 counties that have begun to engage similar work. Lastly, before you go, we will be sending out all of the materials, the recordings, and a brief questionnaire for this session today. We appreciate you completing the questionnaire to provide feedback on today's webinar. Any questions you might still have that we were not able to answer during the webinar, please feel free to reach out to kidsday@dss.ca.gov, and we can respond to your questions. Thank you all again and have a wonderful week. We'll see you next time.